What's up, guys? Dr. Nate here. I'm here with my friend Andrew. He's the marketing director here at Catalyst. He's going to ask me a couple questions today about back pain, other stuff. We're going to have some fun with it. So stick around, and there's going to be a lot of great questions coming your way, hopefully answering a lot of your questions. Andrew, let's get into it, man.
Let's do it. So I was looking at your Facebook and I was looking at all of these different things, and the number one question that I see that a lot of people ask is, what specifically causes lower back pain? Why do people have lower back pain?
I don't know. I don't know. No, I'm just kidding. There's a lot of different reasons. The first thing that we want to rule out when somebody comes in with low back pain is make sure that it's nothing really serious like cancer or something like Codd-Aquinas syndrome, which is characterized by progressive numbness, tingling, and weakness that goes down the legs. That type of stuff, an infection. If you really want to make sure you don't have a spinal infection, because it's not good. So those are the main things you want to look out for. A fracture, if somebody's had like a fall from a significant height, or if they have like osteoporosis and they fell, then you want to rule out any sort of fracture, because that might limit what things you're going to do as you're going through a rehab process. So those are the things that could cause back pain that are more serious. Other thing could be like a muscle strain. Sometimes you can have a herniated disc, which often can be resolved without needing like a surgical procedure or anything like that. There's stenosis, a lot of other things. So stenosis is just like a closing down of the area of the spine around the spinal cord. Some people are symptomatic with this, some are asymptomatic. So asymptomatic meaning they don't have any symptoms, right? So there are a lot of people who have bulging discs and herniated discs, don't have any symptoms. So you have to do a really good clinical exam to determine whether or not that finding on the MRI or X-ray is relevant. And you might ask this question later, but who needs an MRI? Who needs an X-ray? Not everybody. So just because you have some pain doesn't mean you need to go immediately and get imaging done. In fact, people who get it done early, where it's not indicated for, end up having more unnecessary surgeries, a pretty significant amount. So you might think that, what's the harm in getting my image done early? Well, the harm is that you'll probably get a surgery that you don't need. So that's a pretty big harm in my opinion. So
what's the so like for the treatment options, if we're looking at like acute versus like kind of like long-term lower back pain, like the rehab process, like is it very similar for the acute, like I just sprained my back, compared to like, man, I've been having lower back pain for years, like What's the difference between those rehab processes? Like, are they the same? Are they similar? Are they different?
I mean, they're similar and they're different, right? So if it's just an acute lower back incident where what caused it, maybe you like bent and twisted and picked up a couch that you're not used to doing.
A couch, a dog,
a sock. I've heard it all. And with that type of stuff, again, as long as you don't have a severe like neurological deficits, in most cases, as long as you stay moving, it's going to get better. But there is a subset of the population where it doesn't get better, right? Like you might have done those things, maybe you hurt at golfing or something like that, and it's still lingering for months, maybe years, right? And the hard part about that is sometimes surgery doesn't resolve it, injections don't resolve it, medication doesn't really resolve it, and you're like, well, what the heck is going on, right? So my treatment approach is definitely getting people moving, right? And that's with acute and with chronic. Now, with acute flare-ups, oftentimes they will calm down over the course of 6 weeks. But something that's more chronic, it is a little bit more difficult because you have to figure out which movements are aggravating to the person. And they're going to be different for each person. And it might be that they can complete a workout, but then the following day, that's when their symptoms come on. So it's not in the moment that it hurts, it's the day after. And that's more difficult because they might feel really good and motivated during the session, but then after it's like, it just hurts a lot. So you have to be a little bit more cautious and progress people a lot more slowly than you normally would. So I think that's a big difference of acute versus chronic too, is oftentimes you have to progress a lot slower
Yeah.
than with acute.
What are some things that like people can do like today, like people versus like if they have acute, right? Like what's something like they can do to kind of just help them out like right now versus people who have like chronic kind of like low back pain? Like what's something they could do?
Yeah.
Because you know how just like you were saying earlier, how different people have to go through different exercises to feel what feels good and how they tolerate, at least for chronic people. And for acute, probably like rest might be like recommended, but what are some like basic things that are probably good for the majority of people who have low back pain that everybody could do?
Some basic things, and I want to point out it's not just exercise, right? Like that is one component of it. Movement is a component of it. Movement and exercise can be one and the same, different, depends on who you ask. But there's also the aspect of making sure that you understand what's going on, because a lot of people kind of go down, they'll go down the Google search rabbit hole, down Dr. Google, and all of a sudden everyone thinks they have cancer.
Yeah.
And cancer, by the way, is less than 1% of back pain cases. So it's probably not cancer.
Yeah.
I mean,
or they think they have surgery too. They're like, I have to have surgery.
Yeah, exactly, because they're like, mom had surgery.
Yeah.
Oh, it's just in our genetics, and there might be a genetic component, but it's certainly not a huge percentage. So what you can do right now, right, if you have acute low back pain, and assuming it's not from like a car accident, or it's not from like a severe car accident where you have a fracture, right, or some other traumatic event, aside from trauma, first thing to do is you can use heat or ice, right? These are the things to help calm symptoms down. If you're able to take medication that's approved by your doctor, you can do that to calm down some of the inflammatory processes there. Getting moving early. So a lot of people do benefit from literally just going for walks. Like that can be a great way to do it. Some people, though, don't benefit from walks. They have to find something else that feels good. So finding movements that either feel good or don't make it worse is really important. And then the mindset side of things. So just recognizing that this is something that in a lot of cases gets better with time. You just got to stay moving. I don't want to say stay positive, but recognize that it can get better and often will. And just go about trying to get back into your daily routine as much as possible. So those are the biggest things that you can do.
What are things for people to look out for? Because I know, so now we've talked about like, all right, somebody has low back pain, like what causes it? So we know like it can be anything from acute to chronic, and now we know how to like rehab it, at least like taking care and like being super careful for some, but also like, some people can go on walks. So we have that. But now I guess like what we're thinking of is how to not make your back pain worse. Is there anything that people should like do to kind of prevent that?
Well, one thing I will say is you can make it worse if you keep on doing things that aggravate it more and more and more. So sometimes people will keep doing the same thing over and over again, even though it's hurting a lot. Yeah. And so you want to stop doing the things that are really aggravating. And over time, you can reintroduce those into your routine. Okay. Right? You don't have to like stop them forever. Like people start having knee pain and they stop running forever. It's like, well, you didn't have to stop running forever. Or like I've had a client who stopped cycling for 13 years because she was having neck and shoulder pain with it, and her doctor said she could never do it again. Wow. And she's now cycling. Like I think she's shooting for 100 miles. She wants to do a century ride. Wow. So she's back on her bike riding. So just because somebody tells you you can't do it doesn't mean you have to stop forever. Maybe you stop for a little bit, right? Because that was the aggravating factor. Yeah. But you can always, in most cases, reintroduce it in some form or fashion. Maybe not the same intensity. Maybe at the same intensity or higher. It just depends on what your goals are. Yeah. But so those are things to avoid, right? And then I think that's pretty much it. Like that, those are the things that are going to make it worse. And also just staying still for weeks, just resting for weeks is usually not the answer. A couple days, right? If you have an acute back flare up and it's a spasm, give it a couple days to calm down. That's fine. You still want to try to walk a little bit and see if that loosens things up. But I have too many people come in who are like, oh, I just rested it for 2 months. I'm like, rested it for 2 months? Like, wow. I mean, I get it. Like, I get why people want to do that. I think that's kind of an intuitive way to try to heal things, is just by resting. But unfortunately, that just because it's intuitive doesn't make it accurate.
Yeah.
A lot of intuitive things are not accurate.
Yeah.
All the time.
Yeah.
Yeah.
Dang. That's true.
Like when we're hungry, it doesn't mean we're going to die.
Yeah. Yeah, that's a good point.
Like it means we should probably eat. If you don't eat for, 20 days, that might be a problem.
Yeah.
But,
I mean, I think it's the same thing with exercise. If you don't exercise for a long time, it's going to end up being a problem down the road. But also, like, same thing with pain. Like, just because you're having pain doesn't mean you're going to die. Like you're going to...
Yeah, I don't want to put it necessarily that way, in the sense of... because the intuition that we were talking about...
Yeah.
Like, we're not always intuitively correct on what we should or shouldn't do.
Yes.
Right? So in the sense, because pain. If you're having chronic pain or a lot of pain, like,
then that's
you
indicative.
might want it. You might be dealing with depression, or having just like potentially suicidal ideations,
Mm-hmm.
because it is really stressful and painful.
Yeah.
And just more so, it's all consuming, right?
Mm-hmm.
So what I was saying about the you're not going to die is more in the sense of like your intuition to not move.
Yeah.
Right? Your intuition to not move is not accurate. Your intuition when you're hungry to eat is not always accurate. Right?
Yeah.
Especially if you just ate like an hour ago.
Yeah. That totally
you
makes
have enough
sense.
calories in you.
Yeah.
Yeah. So.
If you're hungry, you're not gonna die if you're hungry.
Yeah, and if you have pain, just because your body's telling you to not move, doesn't mean you shouldn't move.
It's like a clue. It's like indicative of kind of giving you the clue on what's next, like what you should be doing.
Yeah, people take the clue as you shouldn't move.
Didn't do anything.
But the clue is actually telling you should do something for the most part. And again, like, you can take a couple days of rest, and that's fine.
Yeah.
In some cases warranted, but not 2 weeks, not 4 weeks, not 2 months. Come on, guys. Not 2 months. Please.
Yeah. Well, I think that's it. Yeah. If you basically have back pain, listen to your body, and this is your clue to kind of get up and keep moving. And if you need more information about specifically what you're dealing with, you can always reach out to Dr. Nate. He has a little online program, and he also has some stuff that you can reach out to him personally about to talk about your issue. So definitely reach out if you have any other questions.
Yeah, thanks, guys. Reach out. You can find me on Instagram, YouTube, Facebook, everywhere. I might even make a TikTok.
Soon. TikTok coming soon.
Is it? Okay, cool. Yeah, I tried TikTok once before. It didn't work for me.
We'll get you rolling. If you guys have any ideas, just leave some comments. All right, we will see you guys next time.
See you guys.